Hey, I'm here today with Tracey Jensen. Hey, Tracey, could you please tell us a little bit about yourself?
Well, sure, and thanks for having me today. So again, my name is Tracey Jensen. I'm a 1996 graduate of the Colorado State University Veterinary Program. I am also boarded by the American Board of Veterinary Practitioners in Canine and Feline Practice. In 1999, my husband and I founded Wellington Veterinary Hospital, and in 2012, we were awarded Practice of the Year by American Animal Hospital Association. Shortly after that, I joined the board for AHA and wrapped up as their president in 2016. 2016 was a busy year because that's the year I joined Blue Heron Consulting as their chief medical officer.
That's great. Tracey, I have some questions for you regarding how prices are set in veterinary medicine. Could you please tell us what's the difference between cost-based fee setting and market-based fee setting?
Yeah, those are great questions. So setting fees in veterinary medicine is a complex issue. And you can either look at setting your fees based on cost. What does it cost you to provide the service? And set your fees based on that. And there's a lot of things that go into that, your payroll, your fixed costs in terms of your rent expenses and things like that. And there's actually a product out there by Zoetis called Profit Solvers that does help try to assess fees based on cost of providing the service. Market-based fee setting is different. It looks at your market. It looks at what are the fees currently being charged by competitors in your direct area. And historically, there's been a couple of products out there to look at market-based fees. Two of the most popular ones are the ones by the OVMA, the Ontario Veterinary Medical Association, as well as the American Animal Hospital Association has their fee reference. The AHA fee reference is based on regions across the country, and then as well as suburban versus urban versus rural. Both of those market-based fee schedules require that the individuals self-report their fees, and they are also still fairly superficial. In other words, with the AHA fee reference, again, it's based on regions of the country, as well as suburban versus urban versus rural. There's actually another product now available called Price Hound, which takes market-based fee setting one step further and looks right at your neighborhood. It looks not by region, rather by zip code. And the other advantage of Price Hound is that those fees are extracted from practice management software and are not self-reported, so that human error has been removed. In addition to Price Hound, there is something called the Fee Optimizer. And the Fee Optimizer takes the data that Price Hound collects from those zip code areas that you select, and then applies it back to your own practice management software, creating suggested fee schedule for you. Takes a lot of the work out of it, and helps keep things very objective in the fees in your area as it compares to your own.
That's very insightful. How often should practices be setting their fees?
Yeah, another great question. Fee setting is something that most veterinarian owners find distasteful, so they don't do it often enough. Sometimes months, even years will go by and the fees have not been adjusted to even follow the CPI. I recommend fees be assessed just like our patients, twice a year. Fee adjustments are much more palatable when they're made in small increments rather than when you're behind by more than 1 or 2 years and your fees need to be adjusted in larger increments.
Wow. Well, that's been very helpful. Thank you, Tracey. I appreciate your time.
Well, thank you for having me.